Hey guys, welcome back to my channel. Today is another video in the Core Concept series. Just as a reminder, this is the 5th video in the Core Concept series. I will link all of the 4 previous videos in the description box below, as well as for each Core Concept video, there is a corresponding case study that can be found in my Etsy shop, and I will list the link to that in the description box as well. So again, just as that quick reminder, this is a Back to the Basics series where we are really trying to understand what is going on inside the body so that we can better care for acute and chronic conditions that our patients may have. So today's concept is going to be infection. So when we think about infection, the definition is the invasion of pathogens that multiply and cause illness. There are several interrelated concepts, so pain, which we have previously talked about, immunity, tissue integrity, and inflammation, which we will be talking about in our next Core Concepts video. So let's think about what causes infection. Well, it could be a bacteria, it could be a virus, it could be a fungus, or it could be a parasite or a protozoa. Infections are classified in 3 ways. So we classify infections by the type of the microorganism. So it's viral or it's bacterial. The extent of spread throughout the body. So it's localized or it's systemic. And then the length of time that the infection has been going on. Is it an acute infection, which tends to resolve quickly, or is it a chronic infection, meaning that it has lasted for more than 12 weeks? So let's backtrack to localized and systemic. Now, these are words that you heard me talk about related to pain, but let's talk about them today related to infection. So localized infections are limited to a specific body area. So maybe you have an infection of the gallbladder, or you have an infection of the lining of the stomach, or you have an infection of a wound on the leg. Those are localized infections. However, in systemic infections, this is where your localized infection has spread and it's now affecting the entire body. So our systemic infections are a big cause of sepsis, which can ultimately lead to septic shock. In septic shock, we do see widespread infection and also a widespread inflammation and vasodilation, which can ultimately lead to multi-organ dysfunction syndrome. So localized infections versus systemic infections. Okay, so what are our risk factors for developing an infection? And wow, there are lots of them. So our immunocompromised patients are more at risk for developing an infection. Patients who have chronic illness in which the body is more debilitated, they're more at risk. As we age, we become more susceptible to infection. Clients who live in crowded or unsanitary environments, clients who ingest contaminated food or water, those with impaired tissue integrity. Remember, our tissue is what protects the insides of our body from infection. And whenever that tissue integrity is disrupted, we have that open portal for pathogens to get into our skin and into our body. Clients that experience continuous or frequent stress. So anytime that our body is undergoing, especially a chronic stress, it does weaken our immune system, and that makes us more susceptible to infection. And then, of course, clients who are exposed to highly contagious infections. So think about your communicable diseases, tuberculosis, let's see, RSV, especially if you're a child, influenza, those highly contagious infections. Once we're exposed, the chance that we will acquire that infection is much higher. Physiologic consequences of an infection. Again, so for localized infections, what we are going to see is inflammation. And so those classic signs are going to be redness, warmth, pain, and then of course swelling. Now, if we don't adequately treat a localized infection, so if we miss those signs and symptoms of a localized infection, of course, it can rapidly progress to be a systemic infection. Systemic infections are where we see fever and leukocytosis, which is a high white blood cell count. And of course, that can very quickly lead to sepsis and septic shock, where we will see decreased perfusion or blood flow, leading to hypotension and possibly that organ failure. So how do we assess for infection? So we're always going to take a good client history and look at those risk factors. We're going to look at recent exposures to people that have contagious or communicable diseases. We're going to look for those classic signs of infection. Now, those are easy when it is an exterior infection. So maybe it's a leg or an arm or a body infection. It's a little harder when that inflammation is attached to an organ like cholecystitis, the gallbladder, or appendicitis, the appendix. So then we have to look for other signs and symptoms of infection. We won't necessarily see that warmth or redness, but we can certainly palpate for tenderness. And then we can also assess for changes in elimination. So often we do see changes in our urination and our bowel habits when we have an infection in our body. We can definitely look at laboratory values. So an elevated white blood cell count with differential, that's leukocytosis. We'll also see, the reason we want to do that differential is we'll also see elevated lymphocytes and elevated neutrophils. And we also can look at an elevated erythrocyte sedimentation rate. So with infection, your ESR will be increased. Your C-reactive protein, the I C-reactive protein, so the inflammatory C-reactive protein, will be increased with infection. And of course, when we culture any body fluids that are draining from, such as an infected wound on the leg, or if we open the body up and culture areas inside the body, we will get a positive culture, which will tell us, what bacteria in particular, or is it, not a bacteria, and maybe it's a viral infection, is affecting our patient. Of course, if it's a bacterial infection, we also get a sensitivity report, and which will tell us which antibiotics are going to treat or combat this infection. Health promotion strategies to prevent infections. So this is where we think about primary and secondary prevention. So primary prevention strategies are strategies in which we really are trying to take risk factors that a client has and really prevent them from turning into an acute or chronic illness. And so immunizations are a great example of primary prevention. Secondary prevention is where your client is where we are screening for an existing infection. So maybe your client has symptoms of a sexually transmitted infection, maybe chlamydia or gonorrhea. And so we do that screening and we diagnose the infection. Once it's diagnosed, we now can treat it, which is also secondary prevention. Interventions for treating infections, of course, are going to depend on what the cause of that or the pathogen that is causing that infection is. So, of course, we have antimicrobial therapy. We have antibacterials, antivirals, antifungals. So some type of antimicrobial drug therapy. Also increasing fluids, helping the client to maintain electrolyte balance, getting sufficient rest, and really important, getting adequate nutrition. All of those are interventions which will help fight infection. Now, when we think about infection, we often think about that complete blood count with differential. So that complete blood count with differential is a whole host of laboratory tests that are accomplished by just one single blood draw. And if you're really interested in understanding the CBC and the components of the CBC and of the differential, what we're looking at, what are the normals, why we're doing these tests on our clients, I am going to be providing a free study guide that explains the entire CBC with differential. So if you're interested in having a copy of that free study guide, please make sure that you send me an email. I will pop the email up on the screen in just a few minutes, and I will be happy to send you a copy of that free CBC Explained study guide. Okay, and then last but not least, there are many prevention strategies that we can teach our clients. So, of course, following the CDC immunization schedule, we've already said that immunizations are primary prevention in the fight against infections. Also, hand washing, a great way to prevent infections. We can use soap and water for 30 seconds or an alcohol-based rub for 15 seconds. Keeping open wounds covered. So we mentioned earlier how tissue integrity is that open portal for pathogens to get into the body. So if we do have a disrupted tissue, then we want to cover that so that pathogens are not able to as easily enter the body. We want to avoid direct contact with other people's wounds, especially if there's any drainage. And then we want to be sure that if we have an infection or we're around someone that has an infection, that we're not sharing personal items such as razors or towels or anything that could spread that infection to other people. For us as nurses, it's really important that we use standard precautions for all of our clients and that we use transmission-based precautions when indicated, of course, based on the diagnosis or the pathogen that is causing the infection. Okay, guys, so hopefully that was helpful as we talked about infection today. Again, if you have any questions or would like to leave me a comment, please do so below. If you're interested in that free CBC Explained study guide, please do email me at the email that you see on the screen. You can also message me on my Twitter account, but do make sure that you email me if you would like a copy of the study guide. I would love to hear from you either way. Have a wonderful day.